Actually, let's talk a little bit more about creatine. We talked about it really briefly on one of our podcasts. But we were kind of at the end. So I want to kind of go back and make sure people understand that it's one of the supplements we get the most questions about. It's also one of the supplements that we feel the most confident telling patients, like, if you know this is a supplement worth taking, it's clearly passed test number 1, which is it's safe, and it passes test number 2, which is it's probably got efficacy. Well, I shouldn't say it's got efficacy. The real question is, are you okay with a little bit of weight gain? 'Cause that's, you're gonna pull more water in. So, explain to people a little bit about why creatine is so important, and presumably, this is something that's really important in powerlifting. I'm guessing going into a bodybuilding meet, you probably don't want creatine for that extra weight. Or do you? So I think it's actually great for bodybuilding. Okay, great. I want to hear about it, 'cause I assumed it would that you have a little more water. But maybe the water is all in the muscle. And that's where you want it, yeah. So creatine is a high energy phosphate donor. So in muscle it exists as phosphocreatine. And when you take supplemental creatine, it'll come into the muscle. It'll get a fast fat attached to it. Fast creatine, and originally the only mechanism we thought of was, well, it's a high energy phosphate donor, so people would perform better. But then we saw people increase their lean body mass, increase their strength, and there's even benefits in terms of cognitive benefits. Appear to be pretty clear that there's some cognitive benefits as well. So as you mentioned, in terms of safety and efficacy data. I mean, to me there's no strikes really. I tell people I don't even know why we're having this conversation anymore, and it's also, it's gone up in price a little bit recently because of the supply chain stuff. But it's still relatively incredibly inexpensive for what you're getting, yep. So when I see people talk about some of these other supplements, and they're not even taking creatine monohydrate, and I'm like, well, you're stepping over pennies, or sorry, you're stepping over dollars to pick up pennies. Because this is just the lowest hanging fruit. But are you still even at your size and even at your demand, is there any benefit to taking more than about 5 grams a day? Some people have postulated there might be. I haven't seen really clear evidence for it yet. You could argue that there's really no downside to taking the extra. The downside might be some GI irritation. For some people, creatine can be a GI irritant, which I think we'll circle back to. But we know it can act as a high energy phosphate donor. So when you are exercising or just doing anything, your energy currency of your cells, ATP, and in order to drive muscular contraction, your ATP donates a phosphate. And that liberation of that phosphate to form ADP. And a free phosphate is energetically favorable and helps drive these muscular contractions. So creatine can act, or phosphate. Creatine can act as a high energy phosphate in order to reform ATP and allow you to perform better. But it's also a really powerful osmolyte, and so it pulls water into muscle tissue, which in and of itself may actually be anabolic. So like just a muscle cell being more hydrated. There's some evidence that can actually improve that it's more anabolic environment. But regardless of the mechanism, we do know that when you take creatine, you see improvements in lean mass. And some people will say, well, that's just water. Well, but that's what muscle mostly is. But muscle is 70% water, so whether it's... And there's actually research to show that even non-contractile just water may improve strength and contractibility. So we're not sure exactly how. But it could just be the volumization of the cell is just a benefit. There's also sort of you could also kind of make up, at least conceptually, a framework that says a more hydrated cell is more able to calculate more able to carry out its function right. So the function of a myofibril is contractile release. contract release, and it has more water. It sort of seems logical to me that it's going to be better at clearing metabolic waste and recruiting fuel, which should at least be two things that would factor into its ability to do that. Yeah, and I mean, the other thing about it is, if you look at like anything that improves hypertrophy, a big portion of it is water, yeah. Like it's not just all myofibrillar. So I think regardless of the mechanisms, I mean it's pretty clear that this stuff works. It's pretty clear it's safe. I mean they've done numerous randomized control trials, some of them being well over a year long. Yes, you get an increase in creatinine, which can be a marker of renal function. But I think although the data, on this lane, there was a paper that just came out a couple weeks ago that we were really happy to see. We've abandoned looking at serum, creatinine for renal function, because it's just too easy to get fooled by people with varying muscle mass, and training volume. So we've completely abandoned it. So every time you order labs on somebody, and you see their creatinine, it'll tell you what their estimated glomerular filtration rate is. We just ignore it completely. We only look at cystatin C. So everything we do is based off that. And there was a paper in JAMA a couple of weeks ago that basically said as much, which is maybe we should look more at statin C instead of GRAN, and so I would even say that hopefully this is a AAPSA for other docs out there listening, and other patients to say, please look at my cystatin C as a way to estimate kidney function. Yeah, I tell people there's some other things that can get a little bit wonky, like from lifting weights, like liver enzymes and whatnot. And I tell people, you have to keep in mind these are markers, okay? So if you have liver failure or you have kidney failure, it's very, very likely you will have elevated liver enzymes and elevated creatinine. But just because you have elevated liver enzymes or elevated creatinine does not mean that you necessarily have damage to those tissues, so you have to disconnect those two. And I don't think that I feel like correlation versus causation is just not something that's taught very well in school, cause I even see not really good doctors, but some physicians get so hung up on just, well, this is on the page, and this is supposed to be a normal range, and it's not. It's like, but just look at the person sitting in front of you, who obviously works out, is in good shape. If you're concerned about their kidneys, then do a 24-hour urine collection or an ultrasound, or whatever you have to do to verify that they're safe. But yeah, I mean I don't worry about that kind of stuff. There's also been some people who have said, well, creatine can cause hair loss and you've got to be careful about that. I'm not. I don't think the data on that's very compelling at all. So there was a single study that showed an increase in DHT from supplementing with creatine. One study 2009. I've never seen it replicated. Never seen any follow-up. How much did DHT increase by? I'd have to go back and look. I can't remember the exact amount. It was significant, okay. But the interesting thing is, we know creatine doesn't affect androgen levels. So it's kind of like, where is this increase in DHT coming from, right? Like it has to come from somewhere. And like I said, there's no randomized control trials showing that creatine actually causes changes to hair follicles or actual hair loss. So maybe it does, but I would think that if that data existed, we probably would have seen it already. Do we think that there are significant benefits from supplementation even on non-lifting days? So for example, on hard cardio days, assuming we're not talking about sprints, so clearly there would be a benefit in sprinting, because the creatine phosphate system is really lending to that ATP generation during that incredibly high intensity stuff. But like if you're out there doing a VO2 max day, that's a really hard day, those are kind of 3 to 8 minute all out intervals, which is aerobic, it's peak aerobic. Do you still get a benefit, do you think, from creatine? I would guess yes. There was a recent meta-analysis that came out and looked at like different ways of taking creatine. And it was useful data, but in some ways it was kind of frustrating. 'Cause they basically showed if you take 5 grams a day, you get increases in lean mass and strength and performance. You take more than 5 grams a day, you also get increases in lean mass and performance. But it's hard to kind of compare them directly, based on the way they did the meta-analysis. And then they also looked at okay, if you just take them on lifting days, okay, you get benefits. If you take them on non-lifting days, you also get benefits. What I would say is that you probably can get away with just taking it on lifting days, but keep in mind that the benefits of creatine are an accumulation. So you really gotta saturate the muscle cell. That's the key, cause when we were kids, you would load it right. You would do like I feel like you did 30 grams a day for a week or something crazy. Yeah, and then 5 grams thereafter. And of course, this was reading bro-science magazines. You would then do that for a couple months. And then you would come off it for a month. And then you would repeat the cycle. Am I making that up, or is that about no? No, that was definitely a thing. Said the I will say that the research does show if you load it, you will saturate the muscle cell faster. Now I always try to tell people like, there's no solutions, there's only trade-offs, right? So the trade-off with this is, a lot of people will get pretty bad GI irritation with loading creatine in terms of like GI bloating, nausea, those sorts of things. So if you just take, if you're playing the long game, it doesn't really matter, right? I mean, you're talking about getting the results you want in 1 week, as opposed to 3 weeks. Yeah, like it's really not a big difference. So if you just want to take 5 grams a day, within a few weeks you'll be saturated, and you'll be getting the same benefits. So it's really, I guess, if you were somebody who never taken it before, and you've got like a big athletic event coming up, and you really want to be on it for it, that could make sense. But for most people, I would say just take 5 grams a day. And when people kind of say, well, you know what, if I just take it on lifting days? Yeah, probably could. But it's also like it's pretty darn cheap. Yeah, so I actually think it's just easier to not forget. It's easier to forget something when you only do it on certain days, right? Sometimes it's just easier to make it a part of the routine. Yeah, and what I would say too is people ask me about timing of creatine, those sorts of things. There's some really small, really tenuous, I really want to emphasize that, evidence that perhaps after a workout might be better than before a workout. But I tell people,